Hello everyone, now I'll discuss question of pediatrics. So we have a 6-month-old girl brought to the physician for evaluation of irritability and listlessness. Well, the parents are concerned that the child cannot sit or roll even though she was able to do so several weeks before. The child was previously healthy except for 2 prior respiratory infections. The patient is hypotonic with hepatosplenomegaly, protruded abdomen. She has a bright red macula on ophthalmic examination along with cervical lymphadenopathy. All deep renal reflexes are diminished, most likely cause of the child development regression. Point to be noted. The other option, which one of the possibilities there? Well, the answer to this question is E, sphingomyelinase deficiency. Why? What's the reason? Well, this child has classical feature of Niemann-Pick disease type A. And this disease is caused by sphingomyelinase deficiency, which is the option E in our question. Well, there are 3 types of NPD, Niemann-Pick disease. Type A is the most severe, and type B and C are milder form. And in our case, it is the type A, which is the severe case. Well, before I proceed further, let me tell you some basic concept about the clinical feature of Niemann-Pick disease. And once we are well versed with that basic concept, then it will be easy for me to discuss the question also. Well, sign and symptom, they are related to organ in which they accumulate. Type A, large abdomen within 3 to 6 months, like in our case also, the patient has protruded abdomen. Cherry red spot in the eye in the macula on fundus examination, but our patient also has feeding difficulty, dysphagia. Rapid decline in the after 6 months, like even in this case also, motor skills in particularly. The patient was previously rolling around, sitting also, but now it is declining. Regression is there. Type B, abdominal swelling may occur in early childhood, not in type A where it occurs within 6 months. No brain or nervous system involvement. Some may develop repeated respiratory infection and breathing problem. Now, our patient is NPD type A. It's a progressive disease, autosomal recessive condition. That means it is a familial disease. Classically present with loss of motor milestone at the age 2 to 6 months, which is a classical finding in our case also. Child is not able to sit now, cannot roll around. Previously, the child was doing this. Now, finding include hepatosplenomegaly, what we have in our patient also. Protruded abdomen, yes, there is some in our patient, and hyporeflexia, classical, very important finding. Why it has a special meaning? Cherry red macula on the ophthalmic examination that you can see here also. We are getting cherry red macula. Okay. Well, it is universally fatal by the age of 3 years. No treatment of this condition, only supportive therapies. Now, we have option A, which is so-called hexosaminidase A deficiency. This leads to Tay-Sachs disease. Is again an autosomal recessive disorder, just like Niemann-Pick disease. And hexosaminidase A deficiency. It also have, there's many features which are common with Tay-Sachs disease, like loss of motor milestones, hypotonia, cherry red macula on fundus examination. But Tay-Sachs disease have hyperreflexia, not areflexia. Very, very important point. And no hepatosplenomegaly. So there are 2 points which really differentiate from Niemann-Pick disease. Well, let me give you a lovely chart. Comparison of the 2 very closely resemble diseases. Niemann-Pick disease and Tay-Sachs disease, sphingomyelinase deficiency, and it is beta-hexosaminidase A deficiency. Both are recessive and both are common in Jewish type of inheritance, Again, a point to be noted. Onset both 2 to 6 months. So far, everything is resembling. Loss of motor milestones, common. Hypotonia, common. Feeding difficulty, common. Cherry red, common. And the problem is this in hepatosplenomegaly attack areflexia, and there is no hepatosplenomegaly and hyperreflexia. So that means the only point of differentiation are hepatosplenomegaly and areflexia are the two things that can differentiate. Now, one more thing you got to remember, note it down. We are getting hypotonia, but still we are getting hyperreflexia, something unique. Normally, is in a neurology, tone is increased, reflex is increased, which is a feature of upper motor neuron disease. But here we are getting hypotonia with hyperreflexia. But here we are getting areflexia or hyperreflexia. So I hope you are clear about it. So now to summarize the whole show, if you are getting Ashkenazi's Jewish inheritance child with the feature of hypotonia and areflexia, protruded abdomen with cherry red macula is a case of Niemann-Pick disease, and hyperreflexia is a case of Tay-Sachs disease. Well, let's look into other option. Option B is galactocerebrosidase deficiency. This result in Crab disease. Recessive lysosomal storage disease is there, but it is recessive. Again, development reflexes, hypotonia, areflexia, cherry red macula. This is not seen. These are not seen. Cherry red macula and organomegaly are not seen, but you can see these two findings. They were there in Niemann-Pick also disease, but this finding is there in Niemann-Pick, which is not there in this case. So we can rule out Crab disease also. But point to be noted, there are many features common between this and Niemann-Pick also. Option C, glucocerebrosidase deficiency, Gaucher disease, anemia, thrombocytopenia, hepatosplenomegaly, no loss of milestone, and cherry red macula not seen. So definitely it is ruled out comfortably. Well, the option D is lysosomal hydrolase deficiency. This is the Hurler disease. It's a type of mucopolysaccharidase lysosomal disease because of deficiency of lysosomal hydrolase. Again, 6 months to 2 years. Little older. Previously, they were all 2 to 6 months, now 6 months to 2 years. Cause facial features, inguinal hernias, corneal clouding. It is such an important clue. If you are getting a child with corneal clouding, with a coarse facial features, perhaps you are dealing with Hurler disease, Hurler syndrome. There can be hepatosplenomegaly there, but this is the golden line to remember. Don't forget this thing. So friends, golden line to remember is Niemann-Pick disease type A is due to sphingomyelinase deficiency, present at the age of 2 to 6 months, areflexia, hepatosplenomegaly, cherry red macula on fundus examination, and regression of the milestone. Milestone are getting regressed. Tay-Sachs disease also present in same way, but in those hepatosplenomegaly is not there and areflexia are not there. There is no hepatosplenomegaly and there is hyperreflexia there in Tay-Sachs disease. Thank you very much.